Cool. Well, hello everybody. Happy Monday. Um, yeah, let's I know Casey said he's gonna be hopping on in about like 10-15 minutes or so. But we can kind of just get going and we do one, two, three, four, five, six, seven. We have quorum. Fantastic, which is really, really awesome. Um, but first, I think it might be kind of cool, I guess, one, calling to order. The meeting has begun. But I want to open up the floor because I think we should do some introductions. We do have a new member joining us for her first meeting ever, Stephanie. So I don't know if you want to start introducing yourself, and then we can go around the room and introduce ourselves if that's helpful.
Sure, I would love to. So Stephanie Brown here, she, her pronouns, and I am currently the state director for the Oregon CASA Network. Hopefully folks are familiar with court-appointed special advocates, but we advocate for kids who have faced abuse or neglect. I've been here about a year. Prior to that, I was running a local CASA program for the last 10 years. Also have some experience in a couple other states in New Jersey and Texas, working for CASA programs, working for the ODHS equivalent as a caseworker, and had experience at a child advocacy center as well. Super excited to be joining you all, and thanks for the warm welcome.
Awesome. Thank you so much, Stephanie. Welcome. We're excited to have you. Well, I guess I'll go, but I know we chatted already. Yeah, Malik Alexander, he, him. I am currently a program manager out here in Multnomah County, supporting houseless youth. Um, and yeah, it's a pleasure to be here and pleasure to have you here. Sorry, I wasn't expecting to run the meeting today, so apologies. Um, but I will pick on somebody else. Jesse, would you like to go?
Absolutely. Thank you, Maria. Hi, my name is Jesse Powell, he, him pronouns. I'm a commissioner, somebody with lived experience that's been part of the system as a youth, and then had my kids also part of the system back in 2017. I'm a parent mentor with Morrison and Child Family Services for my day job. I help individuals navigate the child welfare reunification. I will pass it along to, how about Anne?
Is that me?
That's you.
Okay, great. Thanks, Jesse. I'm Anna Williams. I use she, her pronouns. I am not a member of the Governor's Foster Care Advisory Commission, but I am the staff to the System of Care Advisory Council, and we work very closely together. So I am here to make sure that we stay in alignment and see where we can be partners together. And I will call on Sarah King.
Hello, Sarah King, she, her pronouns. I am filling in on some of Ellen's duties and helping Donna out with the commission until the position's able to be recruited for. Hopefully in September is Donna's hope. Yes. And I am part of the foster care program within ODHS, currently support the ICPC team, as well as kind of this team and other things within the agency. How about the other Sarah, Sarah Powers?
Hi, I'm Sarah Powers, she, her pronouns. I am a pediatrician for Clackamas County Health Department, and I'm also a former Oregon foster youth. And I just officially joined this commission. I think it was a month ago about that I got my appointment. So, but I've been to several meetings. This is, I think, my second official meeting. So good to see you all. And I will pass it to Donna.
Hi everyone, I'm Donna Haney. I use she, her pronouns. I am also not a member of the commission. I support the commission through the foster care program. I'm an assistant manager in the foster care program in central office. And we'll be talking a little bit today about relative certification. I'm happy to be here. How about Judge Jaco?
Hi, I'm Megan Chacot. I'm currently sitting on the Court of Appeals, but before that, I was a juvenile court judge for 8 years. Before that, I represented parents and kids in both the Court of Appeals and in trial courts all around the southern part of the state. And I have also served on various sports training juvenile judges. I think that the work that we do with our foster kids is some of the most impactful work that the courts do. So I appreciate people who serve all the roles that you do. I'm a big fan of CASA, so welcome to our new member. Uh, let's see, I see Matt Crowell is on the, not on the picture, but there, or Matt Crowell, are you there? Oh, perfect.
Yep. Hi, I'm Matt Kroll. I'm a commissioner and I'm a resource parent for the last 7 years. And I'm also a narcotics detective on a high drug task force out in Eastern Oregon. So I travel all over the Pacific Northwest doing my work. Yeah, so I've been doing that since 2017. So about last 9 years off and on. But yeah, that's what I do. And I'll go to Matt Miller, I think it is. The other Matt, yeah.
Yep, the other Matt. Matthew Miller. I'm the owner of Miller's Barbecue, also a newly appointed commissioner as of last month. So super excited to be official. I've been to probably 9 meetings so far, so it's been really great to learn, get involved, and now have it as something that's official. So yeah, I don't know if there's anybody else left except Casey, who's now joined us.
Thank you guys, and apologies for being a couple of minutes late. I was my coverage for court fell through, which happens on occasion. So, but my name is Casey Drew. I'm a commissioner. I've been a commissioner since 2021. Yeah, I missed what the topic was, but by hearing the last couple of people, I think it's just kind of general background information. I am a juvenile dependency attorney, so I work in this field. I represent children and parents. And prior to going to law school in 2020, I did community organizing and political organizing. And I did that for about 8 years after college before I went to law school. So, yeah. And I think Alicia's going to be joining us in a little bit. And I'm sorry, I got a new puppy and she is wild. So if you hear lots of noises, that's what's going on with the new pup. But yeah, I will take a look at the agenda and see where we are here.
We just did introductions. You came in at the right time. So I think we're ready to move on to approving minutes.
Okay, and unfortunately, I took the minutes last time and then had a computer error where my computer crashed. So I wasn't able to send out minutes for last month. I apologize for that. That's all my computer's fault and my fault. So we'll get that. We have on the agenda a section for updates, but it's not the members' comments, concerns, topics to address. Does anybody have any updates pertinent to the commission that they wanted to give before we move to the secretary election? Okay, I have some stuff to talk about during the commissioner comments, but I'll hold it off till then. We do want to take a minute and have an election for secretary. It's a position that is one of the 3 leadership positions on the commission. It's the person who generally takes notes for us and then sends those out at the end of the month or after the meeting. The notes are nothing like capturing every single thing anybody's saying. It's mainly next steps in business items. And so if we were to move to approve the minutes from last month, it would just be recording what the yay votes were and what the nay votes were. And then as we move through the agenda, it's just an opportunity to kind of put in commissioners' comments or speaker comments about things that we might want to follow up next steps on for future meetings. So we'd love to get that position filled. I think it's it doesn't include the monthly meeting because we're only allowed to have 2 commissioners meet without it being a public meeting. So it's really, somebody that's at the leadership position here. And then, we rotate chair and vice chair, annually or semi-annually. And so it kind of gives you a little bit of insight into what we do to set the agenda, the meetings with the governor's office and ODHS. And so we would really love if we could fill that position with somebody. And with that said, would anybody have any interest in being elected to that position or any questions or comments that we can answer about that position. And this is for anybody, including all the new commissioners as well. So we'd love for anybody. Do you have any interest? All right. Well, this is similar to our last meeting when we were trying to get somebody to run for the secretary position. So if there's no interest, I won't spend time begging everybody, but would anybody be willing to take notes for this meeting? And Sarah, I'm going to ask you to, if we can't get a commissioner to do it, if that's okay.
That's fine.
Thank you. Okay, then we'll put that on, we'll continue to put that on the agenda because we really do need to get that position filled. So if anybody wants to give me a call offline and talk about what that entails or has questions, I'm happy to answer it, or I'm sure Malik would be as well. Alicia, I believe, did serve previously.
I would go on the record and say I'm willing to be the backup. It's just my court schedule is crazy, and sometimes I don't want to promise to be here every meeting because I can't.
Fully understood. I get the court agenda. Judge, I'll follow up with you offline and we can have a conversation about it. Donna, we are a few minutes in front of schedule. Are you available to jump in now? Okay, so Donna's here to talk about the relative pathways. And then we have plenty of time. We've got a pretty short agenda today. So after she gives her presentation, if commissioners have questions, I think we got a lot of time to engage with her about it.
Absolutely. And I'm going to share my screen here in a minute and attempt to put my PowerPoint on presentation mode, which I am about 75% successful at doing. Oh, I think it worked. Sorry, I couldn't see you then. I think I talked about relative pathway a little bit. Sorry. Did someone say something?
You haven't shared.
Yes, we can't.
Yeah, I haven't shared quite yet.
Okay.
I've talked about this a little bit previously, and so I don't know exactly what folks want to know. So this will be kind of short, and then happy to have that dialogue, but what I wanted to do was have everybody get on the same have the same general background, particularly there are newer folks here. So some of this might be things some of you have heard before, and for some it will be new. There we go. We're seeing now the screen. Yay. So I wanted to just give a slight history of relative certification in Oregon, because what we've been doing this last couple years, it didn't come out of nowhere, right? This has been a long process. It's not going to lie, it's hard for me to say 2007 was a long time ago, but I'm told it was a long time ago. So it wasn't until then, though, that in Oregon statute, we were able to even reimburse and certify all of our relatives. Prior to that, we could only reimburse and pay the same for a relative caregiver as a non-relative if the child was FOIA eligible, met some federal standards based on federal law. But Oregon law defined foster home as a non-relative home. So there were some legislative changes in between 2007 and 2009. At that same time period, the Oregon legislature passed a law that required us to have a preference for relative and sibling placements and report those efforts to the court. So Oregon, our legislatures back then, I recognized the importance of children being placed with family, and that became a placement preference. We then were able to write our administrative rules to allow for relative placements. Initially, we created what we call a temporary certificate, and we could place relatives that same day. Then we're going to fast forward about 8 years, and the federal government passed the Family First Prevention Services Act, which I'm sure you all are aware of. Part of that was emphasizing prevention of foster care. But when foster care is needed, to have that focus be with placement of relatives. We didn't change our rules at that time much because our relative rules already allowed for a lot of flexibility in assessing and approving relative applicants. And then in 2020, we had some new leadership around that time, and there was the implementation of our Child Welfare Vision for Transformation, which we still have. And again, part of that was emphasizing placing children with relatives. What I want to say about relatives, which I should have started with, is our definition of relatives in Oregon is very expansive. It's a specific rule for child welfare that is includes all the relatives you would think of, grandma, grandpa, cousins, aunties, all of that. But it also includes individuals that the family or child identify as being related to family, godparents, just mom's best friend since childhood that they consider family and the children call auntie, for instance. We don't question that. If the family says this is family, then it's family. And that also includes tribal identification. If a tribe says, based on our tribal customs, this is a family, it's a family, and all of what I'm talking about today applies, and they're certified as relative caregivers. So now we're up to 2023. I went from 2007 to 2023. The federal government passed a new regulation that allowed our what we call child welfare 4E Title 4E agencies. That's the money we get from the federal government to implement relative specific foster care approval standards. Prior to that, the laws regarding 4E really talked about the process being the same between a relative and a non-relative. This was pretty big, pretty new, and it allowed us to think about and establish a specific pathway for relatives and children being placed with them in Oregon. In 2021, we did something regarding our criminal history background check, and this isn't just for relatives, this is for all folks applying to be a resource parent. We really looked hard at them to make sure they were in line with federal law, with ASFA and the Adam Walsh bills, and allowed us to align with our value of placing children with relatives. What we really looked at was making sure that everything we had in the must deny category really was required by federal law to be a must deny. We also revised what we call our weighing test, the factors we look at when somebody has a criminal conviction, to evaluate how not placing the child with the relative will increase their trauma, or placing with the relative will reduce the trauma. And does that criminal conviction really connect to safety currently for the child if that child were to be placed in the home? I'm gonna kind of skip ahead. So in October, so this is October 23, sorry, we became one of 6 jurisdictions around the country to be a pilot in looking at kin-specific standards, relative standards. Many states say kin. I can't tell you why. Way back when we said relative, but we did. So if I say kin, I mean relative. It's interchangeable. So we worked with a national organization that I'll list here in a minute that to develop kin standards and the specific relative home study. So the only thing the federal act really requires, the basic what federal law requires for us when we certify or license our resource parents, including relative resource parents, is that there's criminal background checks for all applicants. And that whatever standards we come up with are reasonably in accordance with recommended standards of national organizations. That's their language. So it's very open-ended. It's very flexible for states to create their own standards. The organizations that we worked with that's recommended really to eliminate as many barriers as possible. They really felt we should follow the federal law, obviously, and really stick to those standards, which, as I just pointed out, are pretty limited. We didn't quite do that. We felt like we need to do some assessment. We were placing children with folks. So these standards are what we kind of landed on. Obviously, the background checks, that includes child abuse background checks, are required. Then we do what some states refer to as a caregiver suitability assessment, but there in parentheses is relative home study. That's what we call it. And so we do a relative home study. For those of you who have been certified, likely went through the SAFE home study model, which is a national model, and we still use the SAFE model. It is has a lot of strengths. It's a very comprehensive look at an applicant, but it was never intended to be used in the sense of a relative sort of child specific. So we're still using that for all our general applicants, but for our relatives, we're using a specific relative home study. We still do the safety and needs assessment of the home. It's actually identical to the one for non-relatives. That's where we walk through the home and look at all the safety components of the home and where the child or children will sleep. I'm going to skip that, at least yellow on my screen for a minute. Again, there was a push to utilize an expansive definition of relative or kin. And actually our definition was looked at by many other states because we already had this expansive definition. The goal of licensing and improving 100% of relatives the same day as placement. Oregon, we have back in 2007, when we got the laws changed to allow for relative certification, we are able to do this now, and even before the relative pathway, under what we call a temporary certificate, but we can't use federal dollars. So we're not approving them fully on that first day, but we're doing that criminal history background check, child abuse background check, walkthrough of the home, interview with the applicants, and issuing this temporary certificate that's good for 60 days. So we then have 60 days to do the full relative home study, which includes getting references, an FBI check, not just a LEDS check, and further interviews with the family. So this is a group of individuals that were part of the model standards. Some of you might have heard of some of these organizations. If not, they're fantastic. If you want to learn more about relative and placement with relatives, these are great organizations. Think of Us is a amazing organization and has a really great leader who tells his story of being in foster care, which I won't, share his story, but you can look it up and listen to him tell it. It's a fantastic story of the importance of family. The Child Welfare Playbook really was the leader here in getting everyone together and actually writing the standards. Generations United and the Grand Families has a great website that has a lot of information about kin support and relative placement. That's like a Second Chance we contracted with for a while. Again, they're an organization out of Pennsylvania that really has been a leader in relative placement in that state, and then now throughout the country really has changed many states and impacted many states, including Oregon's view of relative placement over the years. This is just a brief timeline of what I'm talking about. We started back in 2025 to actually, with the new standards, with the relative home study, with some demonstration sites. So that's how we started this, got some feedback, improved the home study based on the feedback from folks who are actually doing it, the work. And in August of 2025, which is a year ago now, right? We implemented statewide the new standards and new home study for our relatives. And then I wanted to show what we're trying to get at and where we're at now. Our goal is to place children with relatives, that first placement, coming into care, first time placed with the relative 50% of the time. That's what we're trying to achieve. In the last 12 months, I just looked at this morning, it hasn't moved a lot. We have a low over the last 12 months. The lowest month was 32%. The highest month was 47%. It's generally, the first placement is generally hovering right around that 35 to 40% initial placement. Overall, our current relative placement is at about 44%, and that includes all placement types. So that includes our youth and children who are in higher levels of care. That was a lot really fast. A little bit of history, where we're at. I will say our value really is to support our relatives differently. I'm going to stop sharing because you don't need to see. Okay, so our value really is to support our relatives differently. This wasn't really about being able to more easily certify relatives, which is sometimes I hear even from folks in the department, and I'm like, well, really what we want to do is individualize and look at what this child needs. So something I didn't have on the slides, and I know this group, you all have had some concerns about training and our relatives. And so I wanted to share orientation training, which is an overview of the department and some of the bigger standards like discipline and working with the department is required for all of our relative caregivers. They have to go through orientation. Mandatory reporting training is required for all of our relative caregivers. And if that relative has an infant placed with them, our safe sleep training is required for our relatives. What is not required, and I'm happy to talk about this, is our, oh my goodness, I wanted to say foundations training so bad, is our RAFT training, which is required for all of our general applicants. And there are reasons for that. The national recommendation was no training. So we kind of split the difference, so to speak. We felt like what we wanted to do was provide our relatives with a base understanding of working with the department, because it's different. It's not like you just have your niece with you when the child welfare is not involved, right? We're involved, and there are things that folks need to know, and mandatory reporting is one of those significant things, and safe sleep is just so critical. And for those of you who are parents, is well, like me, whose children are in their 20s, safe sleep is very different than when it was when I had babies, so we really want to emphasize and require that training. Judge, yeah.
Does any of the training involve trauma-informed caregiving or figuring out how to deal with kids who are having psychological difficulties being
So that's a great
separated?
question. It is very, what I would say, what's lightly, I don't know, covered in orientation, but not significantly. It is in RAFT, as you may know. But what I would say is all of our trainings, including RAFT, are available to our relatives. And what we do, the idea is our certifiers would work with that relative and look at the RAFT training or other trainings and figure out what makes sense for them with the child that's placed in their home. That is what we're looking at. We're still, it's a year in, so we're still gathering information and data about like what trainings relatives are taking, how many are going through RAFT. And then the big training platform that is quite popular, is KEEP. And we really encourage our relatives connect with KEEP groups. And I'm not sure how familiar folks are with KEEP. And it is, in my experience, one of the more successful contracts we have had for providing support to all of our resource parents. But there's specific affinity groups for our relatives. And that seems to be something that has been really, really successful. So to answer directly your question, not to talk, sorry, Casey, like a lawyer, but it is not required. That's the direct answer. Training like you're talking about, Judge Chico, is not specifically required for our relatives. It is in fact encouraged through RAFT. Sarah, I think I see you, Casey, but Sarah's gonna check me on something I said because
I was just gonna say, I was gonna say that orientation is relative specific.
Mhm.
And so there is a orientation for our general applicants as well as one that's specified for the relatives. And while it's not training, it is one of the questions on the second part of the new relative pathway is talking about impacts of trauma on kids and actually sitting down and talking with the relatives on like how they can help kids cope through trauma, their relatives, and like what they can expect to see. And a lot of the goals with this is kind of creating a more individualized training plan with them based on the needs of the kids that are in their home that are their relatives versus just this general blanket training of RAFT.
Thank you, Sarah.
Mm-hmm. And I see while Casey's closing curtains, I see Matthew's question. It is often
thank you.
Relatives have 30 days to complete I think they have the full 60 days to complete their orientation and their mandatory reporter training. So it is likely that kids are going to be placed in their home without them having any training. But the goal is that when the certifier is going out, that they're going to do some of that introduction kind of in that first meeting. And that's with this kind of more abbreviated than safe study. The goal is more creating those relationships and having those conversations with the relatives and so they can better support them. I will default to Casey now.
Thank you, Sarah. Muted.
Thank you. Appreciate the update, Donna. One of the things why we asked for you to come back and give another update on this was we were discussing in the meeting with the governor's office and Michelle, kind of some of the pilot projects that the agency had been doing previously that we had updates on. And we were made aware at that time that this relative pathway pilot program had become statewide. And so we were like, oh, that's great. Can we get an update on why it moved to statewide, how effective it was? So that was one of the things that we had been discussing with the governor's office, is just making sure that we're circling back to things that we previously discussed and getting updates on them. Donna, I would add that I had previously said I had a couple of items for the commissioner comments. And I just want to bring one of them up now because it kind of ties to it. One of the things that we have been discussing with the governor's office is self-selected placements. And the reason we were bringing that up is we were really trying to go back to what the heart of this commission was and why we started. And it was, started in response to hoteling, the temporary lodging. And it was really kind of what we asked the governor's office is, what can we do to make sure that next big thing that's going to blow up in the media doesn't happen? And so we had transitioned to talking a bit about self-selected placements because it's this bit of a gray area in the law where we place a kid without it essentially being certified. And so that brought us a conversation of, maybe the agency can look at something like certification light and what that would look like for self-selected placement so that we can at least be in the home, maybe offer them some of these trainings. And so I just wanted to give that context because one of my questions was, when you're talking about the 47% that are currently placed with relatives or the 44%, do those include self-selected placements where the children are self-selecting to be with the relative? And the second part of that question is in terms of the certification light, when we have a child, we had brought this up previously, but when we have a child who wants to be with, for instance, a grandparent or another relative who has a sex offense from 25 years ago, and the OARs, just don't really allow a way around it. That was the idea of, well, what can we do to flush that out? When the agency agrees that they're a safe person, we allow them to have unsupervised contact up to 3 days a week because we can't go over that with the foster care. But is there anything we can do as an agency to look at that, to place the child with them? Because essentially what we're doing now is just waiting for that child to be able to say, no, I'm going to do a self-selected placement. And so I brought that up because I felt like it kind of tied to what we were discussing now. And, I do see that we have sort of a certification light for relatives. But if there was a way for us to do that even more for self-selected placements, that's, even lighter because the self-selected placements don't get guardianship or resource parent funding is my understanding. So that was a lot, but that just wanted to give you some context. But
yeah, I mean, that would be a great topic. I could bring somebody in from permanency to specifically talk about that, but I can answer a couple of those questions, and I know other folks have their hands up, but easy answer, no, on the data. The data that went 44% or the first placement with relative, that is a placement. So that is a certified placement with a relative caregiver. So it doesn't include if somebody either doesn't want to be certified or can't be, and it's a self-selected placement. I did actually just look at some numbers, and I'm going to say, don't quote me on this, but the meeting is recorded, so I guess I will be quoting on it. But the number of kids in self-selected placements seem to hover around 80 over about 12 months time. So it's, while not huge, to be honest, that was more than I thought. So I realize out of 3,000 or something, it's not a huge number, but it's a significant number. And there is some guidance around when we can say there is a it is a self-selected placement. But Casey, I'm just gonna be honest, it is a very gray area, and it's literally us trying to keep kids safe when we can't keep them in a placement. If there's a relative that, or it doesn't even have to be a relative, maybe it's their best friend's parent or something, and they're saying, I don't want to be certified, because we get that sometimes. We really try to talk to them about the process, and this, that we can do a temporary certificate, which is sort of your, to use your term, light, but and that will then come with resources. To your point, a self-selected environment is not going to receive for the foster care maintenance payment. It's not going to, medical is more complicated, and but really the payment is pretty significant. So we try to really talk through folks and get them through at least that temporary certification process. And then the must deny. So those are out of federal law. I like to emphasize that. So again, back to history. This is just happens when you got almost 30 years in, but we talk about history. But for 1997, 96, when we were implementing ASFA to 2008, Oregon was an opt-out state, and we could assess any criminal conviction. It doesn't mean we have to say yes, right? Maybe somebody isn't safe based on a conviction they have, but we could at least assess it, go through a weighting test. It was the Adam Walsh legislation that prevented states from being opt-out states. So we had to then look at those must-deny convictions in ASFA and apply them to Oregon law, which is kind of complex because they're just categories in the federal law. And then we had to look at, we use DOJ, of course, but we had to look at Oregon statutes and match them up. So this last time we did it, back when I mentioned that we revised the criminal history rules, we really didn't want to put a conviction in that must deny unless we absolutely had to, like it really fit in to federal law. And the Anna Spickerman from DOJ was fantastic in doing so, and we moved some out of the must deny. So that was a little bit of a win. And saying that, I will share, there are states who have decided they're not going to look at the must deny. They'll still do an assessment and just not claim federal dollars on those placements. Oregon has not done that. There's some complications in statute about following federal law. There's just some, I don't know that there's a lot of interest in doing that, but that is an option some states have gone to. I'll just throw that out there. I didn't come close to hitting on all of your points, but we can actually get someone and really talk about the case planning part around self-selected placements if that's something of interest. Jesse?
Yes, thank you, Donna. So myself, I went through the three onboarding requirement pieces for placement, temporary placement for foster child, and also the second part of that was doing the RAF training. And so I've done the RAF training in person during the pilot, the national, they were gathering data around this process, I believe, on a national level. And so my perspective of the first three and then the RAF training is day and night. And for a person that supports individuals going through the reunification process, and myself, my historical history, I know the value and the impact that RAF training provides to individuals are so vital. They help an individual that has placement of children that are at risk and vulnerable. It gives them a mindset of understanding and healing and process of that individual in a context that is, the value of it. So I'm just like really astonished that you guys have went away from the RAF training component piece. Can you explain how that decision was made and what was some of the reasons why they went away from that?
Sure. I appreciate that feedback, and I will gladly share that feedback with our training team because they will love to hear about your experience with RAFT. So we didn't move away from RAFT in general. RAFT is still our training for all of our resource parents. And it is available, but not required for our relatives. That's where we landed. And the reasoning really was working again with these national partners who, again, their initial recommendation was no required training. And we did not adopt that. And we really, our team, the foster care consultant team, really does work with our certifiers on looking at that RAF training and seeing which modules would be really beneficial to our relative caregivers. So for instance, if it is a, 8-week old baby, or maybe a baby right from the hospital, and going to grandparents, having them sign up and do that RAF training may not be the best thing right then for those grandparents. They need safe sleep before we even walk out of the house. We need to see where that baby's sleeping, and for them to understand what the new or not new, but the newer requirements around safe sleep are. And maybe they need to have training on parenting an infant, or resources for an infant. So whereas some of the RAF training modules may not apply to them. So that's the concept. Again, we're only a year in. So I don't have information on how many relatives are going through RAFT or parts of RAFT yet. But we certainly are hoping it's encouraged for them to do so. Sarah Powers.
Hey, yeah, thank you for providing that. It was really interesting to hear some of the policy background for shifts I've seen for families I care for in my practice, towards more relative placement, because we have a very high number of kids in foster, resource care in Clackamas County, and in my, practice in the health department. So, obviously a lot of benefits in terms of, trauma, for children to be placed with families. And I can see, I can understand the basis for changing the training to facilitate that. And also want to call as a pediatrician, thank you for doing the safe sleep training and emphasizing that, because it is very important, and have definitely lost children in my practice, infants, to unsafe sleep practices. So, but also it does seem like it also presents some specific challenges in terms of, these issues being generational sometimes, substance or mental health, or, abuse. And family systems are obviously very enmeshed typically. So, safety concerns around, supervised visits, or really enforcing that. I'm just curious with those issues, is there any particular training or supervision or things that are done differently with the relative placements to address that reality that, there may be, while there are benefits for the child, to be with the relative, there's also maybe some unique risks or different safety considerations that you might want to address?
Well, I will tell you, a couple of us have this little dream that we would have a relative specific training. And that would be one of the very specific things. Boundaries are different, guilt is different. And there really isn't anything even nationally that sort of gets there. So at this point, the short answer is not really, other than one-on-one work with our certifiers, and then KEEP, that has these affinity groups for relatives that are facilitated. And I think that that is, and then they provide trainings to the folks that are connected to these groups on various topics. So that's what we have right now. But again, KEEP's not required. It's just really, really, really strongly recommended. And for a couple years, I was supervising some certifiers that went around the state and certified homes to sort of get offices caught up. And I heard from those folks how beneficial KEEP was. So I'm thinking in my head, obviously talk to Casey and Malik, or any of you if you have feedback. I'm thinking having Jamie come talk about KEEP might be really great. It is an amazing, amazing service. So that's a partial answer, Sarah. We don't have something I like specifically like you were. I wish we did though. Judge,
Yeah, I'm not
Jaco, you've
familiar
been very patient. Oh, sorry.
I'm not familiar with KEEP. It would be great to learn more.
Okay, perfect.
I just put the link in the chat too for
Oh,
the
excellent.
KEEP Oregon website if anybody's interested in looking at it more.
Judge, I feel like you've been super patient. Your number kept
Oh.
getting bigger. I don't know.
I'm used to being patient, but others were great questions. I hadn't heard that you had opted out of some of the musty knives. I had supervised a guardianship that I had to dismiss the agency out of and monitor it myself for 8 years, and I think that it would be great. Of course, had to do less of that because I think the agency does a good job at making sure the kids are still okay. What kind of things are left as must deny? Is it just all the sex crimes and all the degrees of homicide, or?
It is all degree. Well, there have to be
Do you want me to
felonies.
pull the list?
Sure. We have that handout? Do you have, if you, whatever you have, it'd be great if you could put
I was
it
just
in the
gonna pull
chat.
it from the Secretary of State website real
Okay,
quick.
perfect. Thank you. We were able to move some of the felony convictions that didn't require as a component of the conviction violence. So that's how the federal law is written. It's like it's homicides, felony convictions of homicides, generally speaking, sex crimes, and like other felony convictions involving violence, something like that. And so for years, it was that involving violence that would get us into that category of must deny.
Because
And I will
robberies
say
and things like that.
and
Really
we
old
would look at
robberies.
police reports to
Yeah.
see was violence part of it. And we stopped doing that. Because we decided in that 2021 timeframe, we're going to look only at the conviction. Like if that conviction basis for the requirement of that conviction is violence, then it fell into the must deny. But if it was a different conviction, but the police report maybe said there was violence, just really quick example that I lived with for a long time and was very happy when these rule changes, was a grandparent who had a felony conviction when like 20 years old. I mean, really significant time frame. And she had been she was working, she was a dancer. I think stole something, but the police report said as she ran out, she shoved somebody. And we were fixated on the fact that that included violence and it was robbery.
Yeah.
She was in her early 20s. Like it broke my heart. I'm like, no, no. So something like that, I think like robbery 2, maybe, don't quote me on that, but might have been able to move out of the must denies. So that's what we were able to do. And we stopped doing weighing tests for arrests only. But yeah, homicides, we can't quite get around. But I will tell you, I have had those examples where it was a manslaughter, car accident, early 20s, they're in their 40s, they're a safe person now. And we can't sort of get around that based on the federal law and our state law that connects us to that federal law. So it's sort of complex, but if there's ever that situation, like we really, like a certifier will say, hey, they'll bring it up to central office, we'll bring in DOJ. We really try to get it out of must deny. I mean, it's easier for a must deny because we can get through the due process part pretty quickly, but we really try to get it out of the must deny. But
I mean,
That sounds like a lot of progress.
and there's one recently on ICPC that was a must deny, but has come back because the applicant was able to get it expunged. So I think there's a lot of conversations about that, especially when it's older and likely, but like kind of trying to direct relatives to like where they might be able to get like free legal advice to look at that, and talking with them about withdrawing versus going through the denial process so they can try and get that taken care of and come back later.
And I do want to let everyone know that might be concerned. It's not that we have to approve. We do the weighing test and make a decision about whether we think this person is safe. So we still might end up at a denial. You know, if there was a significant criminal conviction that was, particularly when it's more recent, and it really connects to child safety, we can still deny. And then the applicant has a due process right, and there's an administrative hearing, and there's all of that. But Judge, you were trying to say something, I think.
Oh, my other question was, does the 50% goal come from the fact that ICPC takes longer than the first placement? I mean, it seems like that would make it so we could never get to 100% goal.
That's part of it. Sometimes there's placements, in a hospital is the first placement because of the needs of the baby, or a higher level of care is the first, because of the needs of the youth, they go into a higher level of care as the first placement. And then sometimes there just aren't relatives that we can find and certify. So 100% is probably likely not ever going. We need our resource parents, our general applicant resource parents for sure. But yeah, I mean, to be honest, there was no magical number about 50. We just thought, we looked at the data and went, can we get it up 15% or so on a ongoing basis?
So Donna, if you had a relative who applied and they fit that must deny, I suppose the certification light that we were bouncing around with Michelle was the idea of, if they are must deny, could there still be but we've been in the home, they are a must deny, however, all other things seem safe. And so we support this as a self-selected placement. That's kind of where we're going, because I agree, like there's certain things where you look at it and you're like, no, but there are cases, even sex abuse cases, that just don't align. You have a 19-year-old with a 16-year-old, not a family member, it was a female. And now 30 years later, they want to place a 7-year-old boy with them, and there's just no correlation. And all of the psychologists would say there's no correlation, but it's stuck in our law. And so that's just, circling back, that's one of the things that we've been talking about. I would certainly love to have that in the future as
we would be open to any of those conversations. It would likely require some statutory changes. I don't know, I'd have to think more about it, but also if we could do what some other states do and not pull down the 4E funds, which would also take statutory change, but then they would have, they would receive the maintenance payment, they would be a placement in care. Sometimes these self-selected or light placements, they don't work well for permanency, are we going to get to guardianship? So yeah, that's an interesting concept. How about that? Love to have those conversations about how we can keep kids in their families. That's been my goal for a really long time. So.
And just as a side note, the frustrating thing to me as an attorney is to hear the agency take that position on some of my cases, but then we have another case where the guardian or the grandfather has a sex abuse. My legal advice to the child is, don't get in the car with DHS and leave. And so, child's there on a self-selected placement, and the agency doesn't see cause for removal, although they can't place. And so their next best option was to have the grandparents sign a power of attorney with the mother, who I don't even know how that's, works, because mom didn't have custody in the first place to give the power of attorney. But now we're able to dismiss the case. And I'm like, well, if we're able to do this in this case, why can't we, be flexible in other cases? And so. Okay. Are there any other questions for Donna?
Yeah, I'm interested in understanding how the recommendations are developed for what type of RAF, what portions of the RAF training might be appropriate for an individual family. Like, how we're making sure that's consistent. Are you developing best practices for that?
Those are great questions. I wouldn't say it's consistent, it's individualized. So it would be, this is the concept. The concept is these relatives with this child. So we could have a situation where we're certifying a relative where that child has frankly always lived with that relative. But for a myriad of reasons that I'm sure Casey and Judge Chico have seen. They come into care, but they're staying with that relative that they've been with for 5 years. Those training needs, even around trauma, I think are different than we find a relative and they really have a limited relationship with that child. Maybe they were estranged from the parent, and so now they have this placement. That those needs may be very different. So that certifier should be sitting down with that resource parent and looking at the menu basically of RAFT and other training opportunities, and seeing what makes sense for that placement with that child. It could be, an example I use a lot is grandparents who have never heard of an IEP. Don't know what that is, but now they have a 12-year-old who's on an IEP. They really need to get and understand, and so that they can be educational advocates for that child. They may also need training around trauma and understanding behavior that is connected to trauma. But at what point do they get which training? Because, we have families, when a child's placed with them, that family is also in crisis. So everyone's in crisis. So we have to sort of figure out what information is going to land and stick in someone's brain. So I wouldn't say consistent. I think the goal is more individualized to be successful for that child in that placement.
And just to be clear, what I meant by consistent is not that it's not individualized, but making sure that if a family was to sit down with 2 different certifiers, would they get similar recommendations? Is there a way to make sure that is happening? And do you have best practices to say, well, these types of scenarios would lean us toward this, or trainings, or maybe just even like group staffings to make sure that folks are on the same page about how those occur?
No, I get you. That's a really good point. We don't really have that kind of quality assurance, mechanism. What I would be interested in is gaining from our training folks what trainings relatives are getting, and then maybe looking at it by district to see some of that. Like if there's districts where our relatives are never went to any module of RAFT, or, that might be problematic. So we're still working on sort of pulling all of that in and seeing what's happened in this last year since RAFT was no longer required.
Okay. Well, thank you so much, Donna.
Yeah, of course.
Always appreciate having you. Okay, so let's look here. All right, we're going to move over to member comments, concerns, or topics to address in the future. But I have a couple more things, but we'll open it up to the commission first. Does anybody have any issues that they'd like to see on future agendas? And if you don't bring it up today, it's always fine to email us as well. We tend to set these agenda meetings about 2 weeks before the meeting. So if something comes up in the next couple of weeks and you want to email Sarah or Donna or myself, feel free to. So my 2 issues, one, we've already heard a bunch about, which is self-selected placements. I'm concerned about it. I think, if we're looking at an issue that's going to blow up in the media, given the state that some of my self-selected placements are living in, it worries me that it's going to be the next thing to kind of blow up in the news. I've seen kids where the self-selected placements are, there's just like dog feces all around their beds. They're not going to school. I've had one where the youth was using methamphetamine provided by the self-selected placement. So, I've seen some pretty crazy things, and the agency is just like, well, we can't get in the home. And I get it, because when you have a teenager, they can be very strong-headed and they choose their own placement, but it just, worries me, some of these kids. And I think it's something that if we spent a little bit of time addressing the self-selected placements, I think we'd probably get some more insight on that. So that's one thing that I'd love to see in the future. I don't know if it has to be next month or down the road, but it's something that I think is just kind of out there and we don't know a lot about it. The other issue that I wanted to bring up and sort of connected to today is only because I've been having this issue come up like 4 times in the last month, which is ICPC as it relates to parents. So my understanding is ICPC does not apply to parents from a Court of Appeals ruling. However, the agency has consistently said that that's their process to place out of state with a parent or not. And so we have multiple cases where we appear to have a safe parent that lives out of state, but the agency has to go through this very long ICPC process in order to place. We begin trying to ask for no reasonable efforts to prevent or eliminate the need for removal based on ICPC not being required. However, we have not been able to get trial judges to go along with us on those no reasonable efforts. And so given that that's the state of the law, but that the agency still maintains that ICPC is the route that they have to go, that process I've never seen quicker than 6 months. You know, what can we do to address that and come up with a different process internally for placement with parents that could expedite that the same way that we've expedited relative pathways here in Oregon? So those are 2 issues that I'd like to see in the future. Anybody else have anything else to add?
Yeah. Oh, sorry. Go ahead, Judge.
No, you go, Matt, and then I'll go after you.
Okay. So the piggyback off what Casey said, some of the things I see the problems with the self-selective placements or environments is that there's not a checks and balances system to pull them out of that placement once they're there. A lot of, like Casey said, these teenagers are pretty hard-headed, and part of being a parent is telling them to do certain things when they don't want to do it. And putting them in these homes, I've seen some incredibly unsafe situations. They'll just feed this system down the road. And there definitely needs to be a checks and balances in place to pull these kiddos out of these situations if they get put in a place where they should not be. I've seen it a lot. It includes grandparents with felony convictions. And this is like for narcotic distribution, where the grandparent was hiding the drugs in the kid's cereal, and now they're in Arizona somewhere. They're gone. So, and this is just last year. There needs to be some kind of system in place to pull them back out of that when they recognize that this is not a good idea.
Those situations are terrifying. I've also seen times when a teenager decides to live with girlfriend's parents, and then we end up with a new baby that's in care because they get pregnant. And that it seems like there should be some sort of a way to just say, all right, we allowed this for a while, but it turned out not to be a good situation. What do you do in that? Donna, does your department send initial workers to assess and determine whether it's become dangerous, or do you not even go, if you can't get access to the house, do you not even investigate if you get a call like that?
If we get a call on a baby and like maybe it comes from the hospital or something, we should be doing that assessment. Yeah. And
No.
including the environment. No.
Not
Did I
a baby,
misunderstand?
Like
on
a
one-
16-year-old.
Yeah, on a teenager in a self-selected place.
Oh, if we get a call and it's abuse, we should be going out and doing an assessment. Yeah, but both Matt and to Casey's point, it is difficult with sometimes with teenagers, and but ultimately it's our responsibility to keep kids in our custody safe.
Right. So the worker should be seeing the kids still
Yes,
every
yes.
30 days. Like
Every
that doesn't
30
negate
or every
this.
month. Yes.
Yeah.
They should be, but they don't, because the
Right.
kid doesn't allow it, right? Like we do have some things built into the law, but in reality, most of the stuff isn't or can't happen because the self-selected placement or the child themselves don't wish to engage. Which I fully get that as you know, when I'm representing children, but there's got to be something we can do for, as Matt said, checks and balances, because some of these situations are pretty scary, and eventually one of these are going to blow up and it's going to go to the media and it's going to look really bad. That's all I have to say. I think we should put that on a future agenda.
Yeah. That's what I was gonna say. We'll have this conversation with some other folks from the agency.
I got it written down. Casey, for your ICPC, is it about placing kids with parents out of state, or is it the reversal of kids being
No,
placed with parents here in Oregon?
no, the issue is placement out of state with a parent. And so
Okay.
the courts have said ICPC does not apply to parents, but the agency continues to use ICPC as their route for placement out of state, which makes sense because they want somebody from another agency to check out the home, or from another state to check out the home to supervise things. So I do understand that it involves coordination with another state, whether that's through ICPC or some other expedited program where we can get the kid home quicker so that we don't have a child waiting out in resource care for 12 months when they could be placed safely in home.
I've seen some agency representatives go around that by sending an Oregon caseworker to check out the parent's home in the other state. Do we have a policy that supports that, or was that just creative social working?
I don't know if, because I can't speak to the specific cases, but I'm gonna guess maybe some creative caseworking, because as Casey said, our process is through ICPC, but we can have, I didn't know that, Casey, what you just said about the Court of Appeals. That's interesting, but we can have Vera come, ask Vera, our ICPC program manager, to have that conversation. Yeah.
Well, I say that as definitively. Maybe Judge Chico has a different opinion. I believe that it doesn't apply to parents. I think most attorneys don't. I have seen good faith arguments of people saying it does apply, but I'm pretty sure it's pretty clear in the law now.
Our court has said it does not apply to parents. So the Supreme Court didn't take it up either. They declined review. So I have seen DOJ representatives agree that that is the case, but say that this is our policy, so we're going to do it this way. And it does take a long time. Some states are really good, and some states are so slow. It's just painful, and it just seems to be a crapshoot. So, Sarah, I didn't know that that's what you did, but kudos to you for sticking it out for this long.
Oh, I've only been in there since October, so that's
Well,
why I
good
was
luck to you.
asking, because I will, yeah, make sure that it's passed along to Vera. Vera knows all when it comes to ICPC. I know minimal. Yeah.
All right. Well, if nobody else has any other comments or concerns that they'd like to bring up, I think that we can go ahead and end this meeting a couple minutes early. So great job getting through the agenda. Of course, we'll be together in August next month. Let me just pull the date so I give you the right date. Looks like the 17th. Yes, the 17th of August looks like it'll be our next meeting. So we'll see everybody then. Again, if you have any concerns that you do want to bring up or future agenda items, get them to us as soon as possible, because we meet in the first week of August to kind of set the agenda. So thank you, everybody. Looking
Thank
forward to
you.
seeing you next month.
Thanks. Great conversation, everyone.